Hi, welcome to this unique haircare initiative by IFCAM. Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory, it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems accumulating at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Liza Majumdar is a well-known dermatologist and has been practicing medicine for over many years now. She is MBBS, MD, DND, specializes in dermatology, cosmetology, and psychology. Currently, she is practicing at her own clinic, Dr. Majumdar Skin Clinic, Raipur. Dr. Liza has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized hair care services to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Doctor is also aware of the need for the patient education and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for spending your valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live show.
Thank you, Dr. Mona. Thank you so much. Thank you for this opportunity.
डॉक्टर
For
हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया.
Thank you.
So today we are going to talk about like hair care in current scenario. So like whenever we talk about hair care in current scenario, the very common problem like faced by all of us, like irrespective of gender and age, is like hair loss. And we keep thinking, oh, ye kyun ho raha hai, ye kis liye ho raha hai? So what's normal and when to be concerned for?
Uh, Nowadays, the normal range of hair fall that we come across in a daily life is 50, somewhere about 50 to 100. But
Mm-hmm.
this should not be a concern. Should we be concerned only if the hair fall increases to above 150 to 200 hair per day, or
Mm-hmm.
if you see receding hairline, if you see broader mid parting,
Mm-hmm.
uh, if you see white parting, thinning or baldness, if you see decrease in volume, and if you see increased hair fall while doing day-to-day activities like combing or hair fall, increased hair fall over your pillow. So
Mm-hmm.
this should be the concerns.
Okay, so when the hair is everywhere and people are complaining, oh, your hair is on the pillow, your hair is there and there, so that means it's time to go to the doctor instead of taking.
Yeah.
Yeah.
Yes.
So now the doctor know like what's hair loss and when what are those like alarming signs. And then another like people keep who are prone to hair loss or who are going through this hair loss process, they are like, ये क्यों हो रहा है किस लिए हो रहा है what is this cause, so can you please enlighten us with your profound experience, like what are the general causes of hair loss?
Okay. So I can understand hair loss on a day-to-day basis can be really disappointing. But to correct these conditions, we need to know that hair loss it consists of multiple factors.
Mm-hmm.
There are multiple factors behind it. First of all, it is genetic, which we term it as androgenetic alopecia, which is again broadly divided into male pattern and female pattern hair loss. Now, female pattern will have somewhat this kind of, this
Mm-hmm.
is the pattern of female hair loss,
Mm-hmm.
whereas the mid partition is more and the anterior, the recession is less. While
Yes.
in male type of hair loss, the you can see the recession here, the
Mm-hmm.
frontal recession, hair is going back, and also
Mm-hmm.
the baldness on over the top, that is the
Mm-hmm.
vertex of the scalp.
Mm-hmm.
Okay. So these are the genetic causes. Androgenetic means androgen, which is a hormone, and the genetic causes. Another causes could be another hormonal factors like thyroid. You know, if
Mm-hmm.
there is patient is hyperthyroid or hypothyroid,
Mm-hmm.
and PCOS is a very common condition nowadays, which is seen. Then there can be nutritional. There can be deficiencies in iron, vitamin D3, B12, commonly this macro and micronutrients, vitamins, vitamin
Mm-hmm.
B7.
Mhm.
Then there can be related autoimmune disorders like psoriasis,
Mhm.
uh, SLE, systemic lupus erythematosus.
Mhm.
Stress can be, both emotional stress or
Mhm.
physical stress.
Mhm.
Okay. And
Mhm.
other acute illnesses like fever or patient who has undergone surgeries, certain drugs like chemotherapy,
Mhm.
beyond
Mhm.
certain infections like fungal infections of the scalp,
Mhm.
and some practices like mechanical practices which we do, which we, where we style our hair,
Mhm.
apply so much of heat to our hair, so much of chemicals to our hair.
Mhm. Okay.
So all this.
Yeah. So like it was really like in-depth answer and very informative, doctor. I think um, it's like can be dangerous if you don't take care of it, and I think it's better to go to the doctor.
Yes,
And doctor, like we have talked about these different genetic causes, and even like nowadays we are like having a very busy lifestyle where we don't have like we work late hours, and whatever is available we just eat it and we don't care what's like on the plate. So can a person lifestyle play a role in hair loss?
absolutely, absolutely. Lifestyle nowadays has a major role in hair loss.
Mm-hmm.
The pattern of hair loss, the age of hair loss has also decreased to 20, even 18 years, starts from 18 years, 25 years, 35 years. So these are all early stages
Mm-hmm.
that we come across in patients.
Mm-hmm.
So the lifestyle habits that may cause hair loss could be lack of sleep, again
Mm-hmm.
stress that I talked about, poor diet where daily nutritional requirements are not met,
Mm-hmm.
then habits like smoking and excessive alcohol, again overuse of heating tools, styling, so much of styling, coloring your hair, dyeing.
Mm-hmm.
But all this, there's a part that this could be reversible. These are all lifestyle changes,
Changes.
so
Okay.
this could be reversible.
Okay. Okay. So if you start having a good lifestyle, then all these kind of hair fall can be controlled. Really
Definitely.
interesting. Yeah. So, doctor, like in this era of information, like when people say, "Oh, we have this formula to treat you," and people are quite confused and they keep asking, like, "Okay, what is that right treatment for me?" So, can you please enlighten us, like, what are the medical treatment options for hair loss, like topical, oral, or surgical, or non-surgical, or any other?
Okay. So topical, we have good molecules like that the endogenetic component of hair
Mm-hmm.
loss. We have DHT blockers. DHT is dehydrotestosterone, wherein testosterone is converted into dehydrotestosterone. We take it as bad testosterone. It is that causes hair. So DHT blockers. We have vasodilators like oxidil. We have
Mm-hmm.
finasteride, DHT
Mm-hmm.
blockers, dutasteride, these
Mm-hmm.
medical options. And we have peptides, which are
Mm-hmm.
sildenafil, capexil, and again all those.
Mm-hmm.
That oral medications could be again nutraceuticals, which is boom nowadays. That
Mm-hmm.
is the trend for hair loss nowadays.
Mm-hmm.
Nutraceuticals. Can go for oral DHT blockers
Mm-hmm.
and procedural treatments like growth factor concentrate, like PRP. Autologous. Everything is taken from you. So
Okay.
PRP is in where uh, we draw blood and we infiltrate the
Mm-hmm.
active component which has maximum amount of growth factors onto the
Mm-hmm.
skin. So
Mm-hmm.
all these forms of treatment are available. And lastly, there is hair transplant surgeries.
Okay. Okay.
Yeah,
That's like wide range of treatment is available. If you go to the doctor, then you can get the treatment.
yeah.
Yeah, interesting. Doctor, you mentioned a word called nutraceutical. So can you please enlighten like what is this nutraceutical and what role does it play in hair health?
Yeah. Nutraceuticals is nutrient in a pharmaceutical form,
Mm-hmm.
in a pharmacy form. So that we can, can be orally taken.
Mm-hmm.
So nutraceutical are the food products, which contain vitamins, essential vitamins, uh, proteins, fatty acids, all those components in a form which is, it could be tablet form, capsule form. oil
Mm-hmm.
form,
Mm-hmm.
topical application, or serum formulation. Now,
Mm-hmm.
how do they help in combating hair loss? Is
Mm-hmm.
that they increase, they regulate the hair cycle.
Mm-hmm.
They reduce the inflammation, they reduce the oxidative stress, and hence they increase the strength and viability of the hair.
Okay.
If taken along a prescribed period of time.
Okay.
Yeah.
Okay. So, doctor, they like there are so many this herbal plant extract, phytoconstituent. Are they really useful in managing alopecia or hair loss?
Yeah. We have found results wherein we have given only monotherapy with nutraceuticals, and some patients have really given excellent results
Okay.
without any other modality of treatment.
Oh, okay. Okay. So it's all game of nutrients. So, doctor, in nutrients there are like also like omegas, omega 3 or 6, or like sometimes it is also said like grape seeds. So do they really promote hair growth?
Yeah. They are. See, grapeseed is an antioxidant. Again, it reduces the
Mm-hmm.
oxidative stress.
Mm-hmm.
Omega fatty acid actually they are also a kind of anti-inflammatory agents.
Mm-hmm.
Omega fatty acid rich foods like walnuts, almonds, chia seeds, flax seeds,
Mm-hmm.
which these are all homegrown and home-based products
Mm-hmm.
that are incorporated into capsule or tablet form, or any other form.
Mm-hmm.
So some are also DHT blockers. That's how they work.
Okay,
So
okay. So,
green tea is an excellent nutraceutical, and amla,
mhm,
grapeseed extract, all
mhm,
those methi. The age
yeah,
old products, those products which were taught to us by our grandparents.
yeah, yeah.
Yeah.
And we are just now not eating it, eating only chips, burger, and pizza, and then we are like,
Yes.
interesting, interesting, very informative, doctor. So, doctor, like now that like we are talking about these important food which we actually avoid, can you please enlighten us? Like because common people like us, we don't know like macronutrients or macronutrients. So, what's the plate should look like, and what is this role of micronutrients in hair health?
Okay. The plate should be colorful, as we all know.
Mm-hmm,
Okay, we have to incorporate, more of vegetables,
mm-hmm,
iron-rich foods, which are contained in spinach, broccoli,
mm-hmm,
uh, meat, fish. Then protein-rich foods like eggs, cereals, all those omega
mm-hmm,
fatty acid-rich foods that I've already mentioned.
mm-hmm,
Zinc and are very important micronutrients.
mm-hmm,
These are pumpkin seeds, sunflower seeds, then biotin,
mm-hmm,
which is vitamin B7, is found
mm-hmm,
in egg, and it is also found in moringa.
mm-hmm,
Then vitamins A, C, E, these are all antioxidants.
mm-hmm,
Then, even mild deficiency of these macronutrients can give rise to hair fall.
mm-hmm. Okay. Very interesting. So, doctor, like nowadays on the Instagram and on other like pages of internet where the people say, "Oh, take this gummy. This contain everything," and people start popping those gummies and still they don't get any result. So, is it required to take these nutrients as per gender RDA requirement under the supervision of doctor, or we can buy ourselves and eat it?
Actually, it is very important to consult your doctor first. Why? Because male and female are, built different.
Mhm,
Also, the nutritional requirements of both this population, and according to age also, there are different requirements. So as to not over treat, or over supplement yourself or under supplement yourself.
mhm,
Okay, so recommended daily dietary allowance should be, supervised by a doctor, and only then you can have it.
okay. Okay, and taking it like blindly, does it make any problem?
No, people often tend to come to us that, see, doctor, I'm facing this hair fall issue since quite long, and I've been taking this gummies,
Mhm.
yet no results.
Mm-hmm.
So
Okay.
then we, it's very important to educate people.
Yeah, yeah, yeah. I
The
saw a
proper.
patient like who was taking gummies and he didn't find any solution on a hair fall, but yeah, he increased his sugar levels.
Yeah,
Yeah, yeah.
it's
Uh,
definitely.
So very interesting, doctor. So, doctor, you also mentioned about stress, and you said that stress is really important. So, what is this impact of stress on hair health?
Impact is the stress in both physical and mental stress.
Mm-hmm.
So it may induce inflammation in your skin,
Mm-hmm.
inflammation in your body, and we have three. As we know, we have three phases of hair growth, like which is anagen, which is the active phase of hair growth. Then there is on the other pole there is telogen, which is the resting phase, and that resting phase sheds off. And in between there is a transitional phase, which is catagen. So if stress is not handled properly, the more of hair has been pushed towards the
Mm-hmm.
telogen phase, which is the resting phase, and we
Mm-hmm.
will that hair fall is actually appreciable to patients.
Mm-hmm.
So, stress busting activities, like yoga, meditation, regular exercises may help to alleviate the mental stress. And yeah, also, there are some conditions like alopecia areata, psoriasis. The stress could, aggravate these
Yeah.
conditions.
Mm-hmm.
Also, the rate of hair growth could be slowed down.
Mm-hmm.
That's why it is very important to combat the stress. And
Okay.
also, a good amount of sleep.
Okay. So, even I didn't know that stress can also delay the hair growth speed. So, yeah.
Yes.
So it is very important. So, doctor, now my favorite part. Can you give us some important tips for healthy hair?
There are lots actually, and some of them we already know.
Mm-hmm.
It is not a rocket science that we can't do.
Mm-hmm.
Okay, so the first is balanced diet and all those nutraceuticals that we have talked about.
Mm-hmm.
Then, while washing your hair or combing your hair, you have to be gentle. You have to not vigorously rub your hair after post washing. Not comb. You have to use a white tooth comb while detangling your hair post hair wash. Then hair washes can be limited to 1 or 2 times in a week.
Mm-hmm.
We have to avoid tight hairstyles like tight ponytails.
Mm-hmm.
We have to avoid again, harsh heat or heat styling tools.
Mm-hmm.
All of those. Then we have to treat the underlying conditions like dandruff or any inflammatory condition like psoriasis at an early stage.
Mm-hmm.
And lastly, stress management in the form of yoga, meditation, and all this.
So, to all those female who overdo the heating treatment,
Yeah.
they should control that.
Yeah.
Okay. So, doctor, this discussion was very informative. I'm sure the viewers have found the session very helpful. So, can I take one or two live audience questions, please?
Yeah, yeah, sure.
Yeah. So the first question from our audience is, Hi doctor, my daughter is 12 years old and she's having a lot of gray hair. We tried all the home remedies but nothing is happening to her. Why she has this gray hair at such young age and can it be stopped?
Yeah, it cannot be stopped, but it can be reversed to some extent.
Mm-hmm.
Graying of hair, which we commonly term is in medical terms, is canitis. It is
Mm-hmm.
premature graying of hair, could be due to multiple reasons. It
Mm-hmm.
can be due to nutritional deficiencies, first of all, vitamin D3, B12 deficiencies, and other
Mm-hmm.
micronutrients that we have talked about. It could be due to stress.
Mm-hmm.
It could be familial.
Mm-hmm.
So all these factors, and also it could be associated with other skin conditions like atopic dermatitis.
Mm-hmm.
So, finding the right cause and treating the child at an early stage, with supplements can
Mm-hmm.
help reverse her premature graying to some
Mm-hmm.
extent.
Okay. Okay. So it can be control and reverse if. It
If,
taken.
yeah, these steps are taken at an early stage.
Yeah, yeah. Interesting, doctor. Another question from our viewer is, hi, doctor. How to take your appointment? I am also from Raipur, and I have androgenic alopecia, and all my hair has gone. And somebody told me that I cannot go for hair transplant because I have diabetes. So please help me.
Okay. So,
Mm-hmm.
okay. So we have to evaluate you. My clinic, I'll give the address of my clinic later. So we have to evaluate you. What are the causes of your hair fall? We have to, do some bedside tests done, some investigations done on you. Only
Mm-hmm.
then we can proceed for the, type. We can formulate a treatment chart for you.
Mm-hmm.
Okay.
Mm-hmm. Yeah.
So the earlier you treat, the better.
The better. And also, doctor's clinic is like Dr. Majumdar Skin Clinic. It is in Raipur. You can always Google and find it.
Yes, yes, sure. It is in Shankar Nagar, Raipur. Shankar Nagar it is.
So interesting. I'll just quickly take one last question because we are running out of time.
Sure.
Hi, doctor. I am at my menopausal age and I am having a lot of hair fall. And my friend also got menopause and she took some hormonal imbalance injections and her hair fall is better now. Should I also go for it?
Not every treatment is tailored for everyone.
Mm-hmm.
So without consulting a doctor, do not just go blindly with all these treatments.
Mm-hmm.
The cause of hair fall in your friend could be different than that of yours.
Yeah.
So let us help you with, evaluating what is causing hair fall in you.
Mm-hmm.
And rather than going for something hormonal, let us go with first line of treatments, like topical serums,
Mm-hmm.
lotions,
Mm-hmm.
nutraceuticals, and then we can evaluate. If you're not responding to this kind of treatments, only then we can go ahead with the other modalities.
Okay, but in general, in females, when they reach to their menopausal age, do they have this hair fall issues or like it's not common?
No, no, it is common. It is common. It is common in approximately 60 to 70% of women.
Okay,
Yeah,
okay, interesting.
but yeah,
Yeah, so it's better that they don't find like women who are at the menopausal age, if they are having hair fall or hair issues, they should go to the doctor instead of talking to the neighbors and just getting the treatment done.
yes.
So, doctor, finally, would you like to give any take-home message or any other suggestion to our viewers today?
Yeah, I just suggest people to go to identify any early signs of hair loss
Mm-hmm.
and go consult your dermatologist or trichologist rather than waiting for too long. And
Mm-hmm.
the icebreaker here is majority of the hair fall reasons, hair fall causes are reversible.
Mm-hmm.
So
Yeah, thank you so much, doctor. Thank you so much for sharing all the expertise with us today and answering all the questions of our viewers today. I'm sure the viewers have found the session very beneficial, and I really enjoyed talking to you. I actually have so many questions from our audience. I cannot take all of them, but
yeah,
yes, doctor, if you have some time in future, we can take your appointment again, and we can bust more myths and facts around hair care or skincare and enlighten people more. But yeah,
yes.
thank you for so much for your valuable time and thank you so much. It was delight to have you.
Thank you. Thank you so much for giving this opportunity to, enlighten all of us. And there's so much of, myths and facts that there are many more myths and facts
Yes,
that
yes,
need to, reach out to people.
yeah,
So,
yeah, yeah.
yeah,
So
thank you
and
for this
yeah,
opportunity.
thank you so much, doctor. If you have some time in future, we will connect again and see you again. Let's sign off for today and have a nice day.
Thank you.
Thank you so much, viewer, for joining us today. Yeah, thank you, bye bye.
Bye.